Today's RSA University educational topic is about where to go for appropriate care. Let's learn more.
We all know that navigating your healthcare and insurance can be tricky, so the following information can be used as a guide to know where to start when care is needed. Please note, this presentation should be used for educational purposes only, and that not all services mentioned are covered by all plans. If you're having a medical emergency, please call 911 or go to an emergency room near you. When we say appropriate care, what we mean is that not all tummy aches require a trip to the emergency room. Appropriate level of care means providing the necessary health care in the easiest and most cost-effective manner to you as the individual, as well as the insurance company. There are options available everywhere, some providing more cost savings than others. It is always best to talk with your doctor when experiencing symptoms, but that's not always an option. Let's dive into what options could be available to you, from the most cost-effective options to the least. A great starting point when you don't know where to go for care or have questions related to an illness or injury is nurse hotlines included in most health insurance policies. This is offered directly through the health insurance company and does not require an appointment. Most, if not all, nurse hotlines are available by phone 24/7, 365 days a year, anywhere within the United States. Employee assistance programs, also known as EAPs, are available when a personal or professional issue affects your work, health, and or general well-being. It is up to the employer and the EAP to decide how many visits employees are eligible for per issue. I won't go into all details of how an EAP can assist you, but know that it can be a $0 cost option for mental and behavioral health services for anyone within your household and not just those who are covered under your health plan. You could even waive medical coverage through your employer and still be eligible to participate in this offering. Like nurse hotlines, EAPs have counselors available 24/7, 365 days a year. In addition to nurse hotlines and EAPs, when you're unsure if you need to make an appointment for symptoms you're having, there are options to message your physician directly through sites they create. A common one local to me is Bronson MyChart. Virtual visits, also known as telehealth visits, are commonly offered through multiple channels. Telehealth visits could be available through your insurance company's policy, but also directly through your physician's office. When provided through your insurance company, you speak with a U.S. board certified physician who's available 24/7, 365 days a year, and offer the most cost savings. Sometimes it's no cost. Telehealth visits through your insurance company is a fast, convenient, and affordable way to see a physician for acute care services such as allergies, bites and stings, poison ivy, pink eye, or sinus infections. Telehealth visits can also be used for mental health or behavioral health services as well. Depending on your condition, a physician can prescribe a medication and send it to your preferred pharmacy, develop a treatment plan, and make follow-up visit recommendations. When using this avenue, though, the telehealth physician cannot send a summary of your visit to your primary care physician directly, but will email you a copy that you can provide to them. It is highly recommended that you set up your telehealth account well before you need to use the service, as it can take a few minutes to set up, and no one wants to do that when they're sick. Virtual visits offered by your physician's office can provide you with an option to see your physician or another physician from the same practice within the comfort of your home during their normal business hours. This offering is typically the same cost as seeing your physician in office. Whether you use a virtual visit or a telehealth visit through your insurance company or provider, both are limited to what can be treated through this avenue. When telehealth visits or seeing your physician aren't an option, walk-in clinics are a great opportunity. These are also known as minute clinics. These clinics typically have convenient locations and hours like late nights and weekends, but can also be limited to what they can treat for. Walk-in clinics are commonly used for in-person evaluations to get minor health care and prescriptions. When I believe that my daughter has strep throat, I choose a walk-in clinic over the primary care physician to save in cost. This is a great option when seeking care for things like mild flu-like symptoms, sore throats, eye redness or discharge, or ear pain, to name a few. As shared at the beginning, it is best to have a relationship with your primary care physician who can partner with you for ongoing healthcare needs. Your primary care provider can coordinate your care, provide the best treatment plan, and prescribe medications as needed. Urgent care visits and emergency room visits are significantly more expensive than the other options mentioned, but are deemed necessary for care sometimes. Though urgent care is less expensive than the emergency room, they are an avenue for non-life-threatening conditions that cannot wait for an appointment. This could include services like sprains, minor broken bones, moderate flu-like symptoms, or small cuts that may require stitches. The emergency room is intended for emergencies or symptoms that cannot wait. Some examples include bleeding that won't stop, pain in the chest or one arm, poison or drug overdose, seizures or slurred speech, broken bones, and concussions. To conclude, while the answer is not always the simplest to make, knowing the difference between your options of where to go can make a huge difference. If you have questions or want to learn more about your choices for care when it's not an emergency, contact your Rose Street Advisors relationship manager or our general mailbox at info@rosestreetadvisors.com. You can also call us at 269-552-3200, and they can get you to the right person to help. Thank you for watching today.